Hello, this is Jeremiah Gibson with the New England Association for Family and Systemic Therapy. I'm so happy to be joined this afternoon by Janine Roberts. Janine has been a practicing family therapist for 40 years. She was the chair of the doctoral and master's program in family therapy at UMass Amherst for some 20 years and has trained and supervised in-home therapists in the US and in Latin America. Dr. Roberts is the author and co-author of 4 books, including one poetry book, The Body Alters, as well as some 70 book chapters and articles. She's researched and written extensively about our social identities and therapeutic work, family stories and rituals, as well as supervision and training, among other topics. Janine is presenting at the In-Home Family Therapy Workshop, Our Stories and Theirs, fully engaging ourselves and our clients in in-home therapy, on Friday, April 24th at Brightside in Holyoke, and we're happy to co-sponsor that with the Couple and Family Institute of New England. Janine, thank you so much for joining me this afternoon.
It's my pleasure, Jeremiah. And first and foremost, I want to thank you for your vision and your hundreds of hours of work, along with other people, for creating and supporting NEFAST.
Thank you so much.
It's a labor of love, I know, so thank you.
It is definitely a labor of love, yes. And the labor of love that really ties into the program that you're doing. As a younger therapist, a lot of therapists that are within like 10 years of me are getting trained in agencies who do in-home family therapy. And unfortunately, and you know this better than I do, unfortunately, more and more these newer therapists are kind of being thrown to the wolves and just kind of given a manual and kind of being sent out, working with some really challenging families without the educational tools or that supervision tools that could really help them be successful. So I'm really, really excited to have your expertise and your presence at the conference at the end of April. So thank you for being willing to partner with us on this.
I look forward to it.
Yeah, so I'm curious, just personally speaking, how did you get interested in in-home family therapy?
Well, my very first practicum when I was in grad school in the late 70s was to go out into family homes where teens were on probation and the family had court-mandated family therapy. And that was a real learning experience for me, because I remember one 15-year-old boy, it's actually the very first family that I saw, and he had been caught shoplifting several times. Mm-hmm. And right away in the very first session, he challenged me and he said, you know, why should I talk to you? And what are you going to tell the courts about me? And I had to quickly begin to sort out with him the difference between therapeutic work and social control. And when we get called in to do some kinds of social control, so that we could begin to make an alliance around, okay, what are the things that I can do to help you get through this probation, or help you understand how you got to this place? I'm here to be a support to you, and I'm not reporting details to the courts.
Right.
And those first families that I saw in their homes were really key teachers to me. And when I had my next experience working with families, which was actually my first job, I was doing family therapy and residential treatment. And I had seen the importance of knowing some things about the culture of the family, the ambiance, what the living situation is actually like. And so I was made home visits to the families that I was then working with once their teens came into the residential treatment center. Mm-hmm. And I'll never forget this one young woman that I worked with who had chosen not to walk or talk for 2 years. Mm-hmm. And for me to go to their home as part of the intake process and see how the father had gotten a particular way to walk her, the mother another way to walk her, how they were in competition about what was the best way to walk her. I gained all kinds of information that I could then bring back to the residential treatment center as we began to think about how are we going to work with this young person with a bunch of other teens who were acting out. It was such a different set of issues that she was struggling with.
Mm-hmm.
And I'll never forget either how one of the things that we did once she could start doing home visits after being in the treatment center for a couple of months, we had gotten her a parakeet because her parents were convinced that she didn't know how to talk because her muscles for 2 years had gotten, so tight,
Mm-hmm.
and that she needed to practice. And so she was practicing with this bird so that she could do it in private because she didn't want to talk in front of anybody. And I also began to do supervision for People's Bridge Action in Athol, who were working in family homes, and for LIFT at UMass. And even at UMass, once I started teaching there, we would bring as much as we could of parts of the family into the clinic. We had a clinic in Tobin Hall, and I'll never forget this one family who always talked about how they could tell when this tension and the stress was getting to people within the house because the dog would had such, reaction to it, and it would have these sort of little mini seizures. So we asked them to bring the dog into the sessions.
Yeah.
And so I really, from the very beginning of my work, saw the ways that it's important to understand and respect the rhythm, the routines,
Mm-hmm.
the ambiance of the household or the apartment. And I think doing in-home work, you have a tremendous access to information that in some ways can make the work go more quickly and more profoundly than when you're just seeing somebody in an office where you're in some ways structuring more of the interaction and creating the boundaries. At the same time, you have some unique challenges in how to create a collaborative relationship so that you can create therapeutic space within a living space.
Right.
And have a protected time and space to do that. And at the same time as well, when you can make changes within that environment, they can be very powerful. Yeah. And you actually can see them in a different way than you can ever see them in a more sterile therapeutic treatment room.
Yeah. Yeah, there are a lot of ethical considerations and a lot of variables that you miss out on by not seeing a person's entire context in front of you. So that's really cool how you're able to even like involve animals, involve the bird, involve the dog, into the different types of therapy that you did with these folks. At the in-home family therapy workshop, you talk about 3 different phases to in-home therapy. One is gathering and joining a family, and you talked a little bit about some of the challenges of that a minute ago. You talk about something called multigenerational witnessing, healing, and change, and then also transitioning out of family work. What do you find as the biggest challenges to joining and gathering a family?
You're always working to build trust and connection with people of varied backgrounds, varied ages, varied social identities, different genders. You have to have a dexterity and a fluidity to get down on the floor with the 2-year-old, to see the abuela, the grandmother, in the kitchen and invite her in as somebody who has sabiduría, who has wisdom. And you have to, at the same time that you're trying to connect with individuals, know that you're being watched by others to see, are you respectful to other people within the family? Are you comfortable with them? And are you respectful of whatever the rules within the household might be? I remember early on with one African American family in an apartment, the mother saying, now this is Miss Janine, and you must call her Miss Janine. And I actually prefer that people call me just Janine.
Right.
But I needed to respect that
Mm-hmm.
and follow the lead
Mm-hmm.
of the mother there. So how do you join with fluidity and let people know that you're aware that you need to earn their trust, by your behavior?
Yeah.
And knowing that your behavior is being, like I said, observed.
Right.
And at the same time, sometimes the gathering, which is different than the joining, because a gathering is getting people together. The gathering can happen, like for instance, with the young man, 15, who had shoplifted. I had a couple of rounds of phone contact with the mother first, and I tried to get an entrance in terms of how could she help to gather people. You can also do things that will want to invite people in, simple but direct activities where people want to come and get together. They're all, the goal here is to keep it in the air. This, by the way, was some work that was being done in Nairobi, Kenya, where I was doing some training several years ago.
Yeah, one of the challenges that I'm thinking about, Janine, particularly for newer therapists, is this, I think, internalized pressure, particularly like getting out of graduate school, and then also having to meet some of the requirements of agencies, this internalized pressure to be the expert.
Mm-hmm.
And how frequently like this desire to, or this pressure, I should say, to be the expert, how frequently that gets in the way of joining and really respecting a family's rhythm. And I'm curious what feedback you might give to newer clinicians, particularly to trust the process.
Well, I think one thing goes back to what I said at the very beginning, right after you asked this question, is the fluidity of just, okay, how can I make some small gesture to connect with this person, some small gesture to connect with that one. It's not going to be perfect, but I have to be moving, and I have to be aware of that I'm here to support everyone that's we have hopefully gathered together. I mean, sometimes not everybody has gathered together,
right?
And they're in another room, and you're aware of that, and the people who are in the room are aware of that, and you can set up things where you say, whenever you're ready, if you want to pass a note into us, we'd be glad to read it, or you pass a note out to them, or there's a door that's partially open, and you make sure you're talking loud enough so that a person can hear you. And make invitations within that, because sometimes it takes a while to gather people together. And another photo that I want to share is from work in Ecuador. So this is where a therapist is washing clothes with the mother of the family. This is something that the mother did on a regular basis to bring income in for her and her 5 boys. And Marilee, the therapist on the right, had to just go once a week for a few weeks and wash clothes with her and talk and start to make a relationship before they could actually start the family work. So there may be some creative ways that we need to think of to do the gathering. Right. Yeah, you're entering into their ambiance, into their rhythm.
Another thing that I'm curious about is this idea of multi-generational witnessing. I love that language, and I'm curious, what are some ways that you'll be describing multi-generational witnessing and healing at the workshop?
Mhm. Yeah, we're going to be doing different techniques that hopefully can lead to that kind of uh, witnessing and healing. For instance, if we go back to that 15-year-old young man
Mm-hmm.
who had stolen a number of items from stores,
Mm-hmm.
one of the things that I did with the family the third session was to gather a timeline of the last 10 years
Mm-hmm.
of what were things that were working well, what were hard events in the last 10 years. So we'll be working with a bunch of different strategies, and this will be one of them. And it was interesting, the family made the timeline,
Mm-hmm.
and then I asked them, I said, well, would it be helpful if you each did your own separate timeline of any part of this that was particularly hard for you?
Mm-hmm.
And the 15-year-old chose to do the sequencing of when he was stealing. He wrote in on the timeline, I was looking for something. I was trying to get something around and he had drawn pictures of some of the things that he had stolen.
Mm-hmm.
And it turned out that the father had left abruptly when this young man was 13.
Mm-hmm.
And that had come out in the larger family timeline. And I had also been given that information from the court. And it was a very difficult time for the family. And he started to make some connections between what he was grappling with and he was looking for something
Mm-hmm.
in the loss of his dad. And there's lots of different ways that you can do timelines
Mm-hmm.
too. You can just draw them with, using lots of different colors. But you can also use clay. You can use plastilina, which is like this kind of plastic clay,
Oh,
which
cool.
is
Yeah.
not as messy as real clay. So that's what I have a picture of. And this is a young man in Ecuador with his therapist making a timeline of his life up to that point, as a way to try to help him understand some pretty serious traumatic events that had happened in his life. And sometimes we have to pull individuals out for some individual special time, individual work.
Mm-hmm.
And that's what this therapist was doing. You can see she has an apron on that has some little figures on it. And
Yeah.
it says Huconi.
Who called?
That means together with the children in Spanish. Junto con
Cool.
los niños y niñas. And for the last 20 years, I've been working with them to develop, in-home family therapy model for street kids and their families.
Great. Just for
And
spelling purposes, Juconi, Juconi.
yeah.
Just for folks who are interested in Googling this.
Yeah, and the model is used in a number of countries around the world now, including that picture that we saw earlier that was in Nairobi and the one in Ecuador. Okay, so why with the timeline, going back to the 15-year-old, how can that help with witnessing and healing? It works on multiple levels because he has an internal experience
Mm-hmm.
of trying to grapple with what was going on with him
Right.
then as he's creating this timeline, writing some of the phrases, using different colors to show different emotions, drawing some of the things that he stole. But the family also has an experience to witness and support him as he's working
Right.
with that. You can give prompts that help to look for the strengths, the resilience, the courage, and say to the family, like, what do you see about the courage that your son is showing by being able to talk about this? Or what do you see about this courage that your brother has to face this, head on and take responsibility?
Mm-hmm.
for what he did. It's very different than you working with an individual when you can have this kind of familial hearing, seeing, supporting. And there is something about actually manipulating and working with things like art materials that can help people to tell the story.
Yeah, you've written a book called Tales in Transformation, Stories in Families and Family Therapy. I'm curious how that book talks about some of what you're describing.
Well, it's really about what are the multi-generational experiences that we have with story, and how do we pass those down, and what kind of legacy gets brought forward, and then how do we each work with those within our own individual lives and within our family life. So I think the last thing that I want to say about this multi-generational witnessing and healing,
Mm-hmm.
So this was a photo that Maria, who had been sexually abused by her stepfather, drew, and she drew it looking straight on at the house, which was interesting. And the red lines, after she drew it, she put through her mother, madre, his mother. And this was something where I and one of the therapists, we were in a small house that had a separating wall with a doorway through it. And one of the therapists, this was in Ecuador, was working with the 5 boys in the other room. So we saw Maria before, washing clothes with Marilee. And we knew that there had been some real difficult trauma in her youth, but we didn't know the details of it. And so asked her to draw the house that she lived in before, and we knew that she had been sent to this juvenile detention center when she was 12. And the story slowly came out that her stepfather had raped her. She told her mother did not believe her.
Got it.
And mother literally sent her to this juvenile detention center, and made up things about these terrible things that she had done in the home and so on. And we thought that this would be something important for her to share with her 5 boys at some point, because she would often disassociate from them and not be able to connect to them. And pull back from them, and it was very painful for them, and they really couldn't understand it. And so somebody was working in the other room with the 5 boys, and we thought maybe at the end of the session, the mother might be able to share this with them. But she was in no way ready to do that. It was just so raw for her, and there needed to be a lot more individual work done with her.
Right.
It was so interesting what she did. She took the drawing, she rolled the paper up, she handed it to her therapist. She said, "You take it back to the office and you keep it for a while." And it was almost as if she was releasing it.
Yeah, I'm done with this.
I need space from this for right now.
Yeah.
But then that was a tool that they could then come back to when Maria was ready.
Right.
To work with.
Yeah.
So you have to really think carefully about what gets disclosed when and where, and what kind of witnessing can be done when and where.
How did the therapist and Maria make the decision to readdress the painting?
Well, they ended up having several more sessions spread out over several more months, just her and the therapist, for Maria to work through more what she was carrying, and the pain and the hurt and the trauma. And then she was ready to share it with her boys.
How did that session go?
Well, for the boys, it was a mix, because there was terrific grief,
of course,
about what their mom had gone through.
Yeah.
And at the same time, there was relief that it wasn't their fault that
Right.
their mom would get so distant from them sometimes. There was some explanation for it. There was some understanding.
Yeah.
It was really an interesting mix of feelings.
What happened in the following sessions?
Well, one of the main presenting problems for this family,
Mm-hmm.
and something actually that the boys were working on in the other room when the mom was doing this really uncovering of what she had gone through and having witnessing and healing from the therapist, and I was there accompanying the therapist.
Mm-hmm.
So from the two of us, the other five boys in the other room, the five boys were drawing street plans of their work out in the streets, because as
Okay.
I said before, these are families where the families are so poor they're sending the kids out in the street to work. And they drew, each of them, a street plan of
Mm-hmm.
what it was like for them. And the goal was to get the kids off of the street
Mm-hmm.
and back in school,
Yeah.
which we saw with the photo of the boy with the tie. He was back in school.
Okay.
Family had done enough work to get themselves organized to get him back in
Yeah.
school.
Yeah.
But none of these five boys were. After the mother, Maria, had rolled up this drawing that we
Mm-hmm.
have in front of us, she said she was ready to see the street plans of the kids. And they were very clear about the dangers on the street. The
Yeah.
oldest one was washing windshields, when your cars stop at a red light.
Right.
And he said, a month ago when I was trying to wash the windshield, the man lifted up a gun. The driver lifted up a gun and said, "Get your hands off my car."
Mm.
He said, "That's why I wanted to stop washing windshields. I'd rather sing on the bus
Sure.
because I can see people smile and sometimes I make people happy."
Mm. Yeah.
And they each had stories of the police chasing them, other kids going after them with sticks and rocks.
Yeah.
And what is a long response to your question of what happened after, the next sessions,
Yeah.
after the mom disclosed some of this.
Yeah.
The boys, one by one, starting with the youngest first, actually,
Mm-hmm.
who was, I think he was around 8,
Okay.
started, the mom started getting focused and getting the energy, get them each back in school.
What a beautiful story. Thank you so much for sharing this. And one of the beautiful parts of both this interview, as I'm sure that you've seen in the last few minutes, and of the workshop itself, is that I'm sure, Janine, that there are 60, 70, 80 different stories like that you could tell, that are case studies for
Oh, I've got many.
your experience of this model. And I guess, I'm curious, what are other therapeutic skills that you'd like participants to leave with?
Mm-hmm. Well, there will definitely be a focus on what's unique
Mm-hmm.
about listening when you're working in a family
Mm-hmm.
or with a family in larger systems
Yeah.
or even in a team meeting, because your listening is being observed at the same times that you're observing others,
Right.
listening while you're trying to deeply listen to one person.
Yeah. Yeah.
And it's a multi-tiered, multi-layered process.
Mm-hmm.
Someone once said to me, it's like being a single mom with 3 kids under the age of 5.
Yeah.
And
Yeah.
you're scanning, you're paying attention, you're trying to link what's happening over here with what's happening over there.
And they're also paying
And
attention to you as well.
exactly, and they're observing you're listening, which goes
Right.
back to that,
Right.
observing how you're joining or not joining within the family. Not only taking in one person's point of view, one person's story, but
Yeah.
seeing how other people are reacting to it. and helping other people to perhaps shift and change some of their own ways that they respond to that story. That will be a grounding for the
Mm-hmm.
whole workshop.
Yeah.
And also the whole question of speaking. I mean, sometimes it's easier to speak, when you have some other way to speak.
Love it.
So,
Yeah.
so we'll do some stuff with paper bag puppets.
Yep.
So they're making the puppets so that they can have other ways to speak, other than, because sometimes, like I said, you can choose your favorite animal, you can choose your favorite character, you can choose to be a different age, a different gender. And so one thing that I think is really important is that we leave families with some tools that they have, things they can do and use in between sessions.
Yeah.
Because we're with them relatively short period of time.
Right.
And so this is one of the inexpensive, easy to make tools that you can give to families and collaborate with families in making. Yeah.
You've asked folks to bring 5 to 7 pictures of themselves throughout their childhood with other members of their families. I'm curious how you're planning on incorporating these during the workshop.
Mm-hmm. Well, again, it'll be something that we'll do together in small groups. I'm sure people have gotten the sense by now that this is a very experiential workshop.
Yep.
And there's lots of things that you can do with photos. You can look at social identities within a family. You can look at family life cycle and how the family changes over the family life cycle. What does it mean to be trans or an immigrant within this family? We are always transitioning in our life, and so photographs they're often taken at key transition points, whether it's a first day of school, or it's a wedding, or it's a graduation, a death.
Yeah.
So we often have photos from different important times. So for example, to go back again to that 15-year-old boy who shoplifted,
Mm-hmm.
the father was trying to reconnect and reach out to the 3 kids and get more involved in their lives
Yeah.
after he had so abruptly left. And they were really pushing back against that.
Yeah.
So one of the things that we did was get some pictures out of him of when things were better in their relationship with him, and just use those as prompts for, what memories do you have, and what was easy about being with him then, and what did you enjoy? Were there any hard things?
Yeah.
What are you afraid of if you spend more time with him now?
Right.
And the photos became a real tool.
Yeah.
And a resource. And you can do all kinds of things with, with having our phones and our photography. So, at our fingertips, you can, if a particular family is having issues with expressing different kinds of emotions and things that are hard to talk about and so on, you can take photos of, okay, well, what's a facial expression that you can make that will show the difficulty of this? What's a facial expression that you can make to show that you broke through that and you were able to begin to talk about it?
Yeah.
What's a facial expression that you might have after you've been able to have that kind of discussion?
Right.
So photos can be a terrific resource and used in myriad ways, and right in a session or with people going to archives. I've often worked with couples, like, what first brought you together? Bring me a few photos of when you first got together.
Yeah.
It's a very different experience than 30 years down the road.
Sure. No, that's a really good idea. I love that.
So we'll brainstorm, what are some different ways that you can then use photos more in your own work. And throughout, I'm asking people to do some things that they might be asking clients to do.
Mm-hmm.
I
Right.
don't think it's really fair to ask our clients to do things if we haven't gotten kind of inside of them ourselves
Absolutely.
and experienced them. For
Yeah.
example, what people have choices throughout the workshop to
Sure.
choose different things to do, because we can't do all of these things, all of us, but small groups can break off and do some of them and then share what they found out about that particular activity or therapeutic technique.
Mm-hmm.
So for example, one thing that people have the opportunity to do is a mini floor plan of the house or apartment that is hardest for them to work in currently in their caseload.
Mm, that's great.
And try to sort out, okay, why? What is it about
Mhm.
how we're organizing or how I'm connected or not? Or
Right.
yeah. So
Right.
throughout the day, there'll be lots of opportunities to explore things and
Mhm.
apply them directly to people's actual work.
Love that. Yeah, because it's one thing to talk about rituals and like how to design rituals. It's another thing to recognize your own role in the family that you're working with, your
Mm-hmm.
presence and your story. So glad that you're bringing in these experiential exercises. Thank you so much for joining me today, Janine. I also noticed that you have a book over your right shoulder, Rituals in Families and Family Therapy. Uh,
Mm-hmm. It's another one of them. Yeah.
Feel free to check that out on Amazon or wherever you get your books. What book is this?
Yeah, it's Rituals for Our Times.
Just for Our Times. Excellent.
Mm-hmm.
Um, and then you have a website too where you have the book of poetry. Is that right? The Body Altars.
Yes, I do. That's
What
the book of
is
poetry.
what is your website?
It's www.slateroof.com.
Perfect. Excellent. Well, thank you so much for joining me today, Janine, and sharing your wisdom, your experience, and the folks that are coming to the conference Friday, April 24th at Brightside in Holyoke are going to get an absolute treat. So for more information on that conference, go to our website, www.neafast, that's neafast.org. Hope that you have a wonderful rest of the day. Again, thank you, Janine, for joining me today.
You as well, Jeremiah. Take care.